is in the middle of a mental health crisis, but what's life like for those who need help the most? Hardships are mounting for Syrians in Idlib, where hundreds of thousands who have fled from violence are struggling without enough food, medicine, housing, and jobs, as well as the ongoing threat to their lives caused by the bombing of cities, schools, and hospitals. Syria is home to over 18 million people, nearly half of whom are in need of mental health support. We talked to Asam's mental health coordinator to find out what the situation is really like.
When I are talking about people in Syria, mostly we are talking about trauma-related problems, because again, it's life-threatening situation. And of course, the other kind of stresses, there is no work, there is no money, there is no, even sometimes sources, the simplest kind of, there is no water, there is no food. Now, with this massive displacement, which is happening in Idlib, people living under trees. So what kind of, it's too much differs now. Even now, people started to rent their trees. And if you want to stay under my tree, you should pay for it. We cannot blame who's renting his tree. You don't know what kind of situation he's been through as well. We are in a war situation here inside Syria, no judgment now. So in this kind of, it's chaotic socially, emotionally. So you can find more severe cases, of course. You can find more psychosis. You can find more suicidal ideation. You can find, it's a matter of severity. And we can find complex disorders. You can find somebody with PTSD, with depression, with phobic, with a lot of, because it's multiple and complicated disorders.
Amidst the ongoing crisis, certain communities are more vulnerable to poor health and mental health outcomes. Syrian children living in conflict zones have become highly susceptible to depression, anxiety, and other forms of mental illness. These children live in constant fear of attack. Nearly half of all Syrian children display symptoms of PTSD. When a whole population must focus on staying alive, it becomes harder to focus on children's healthy development. Here is one of the children we met at an IDP camp in northwestern Syria. The war has had a significant impact on his school attendance.
تقريبا سنتين ونحن طلعنا البابا لأنه صار قصف كتير عاد يضربوا علينا ونحن كنا هناك عندنا المدرسة هناك طابقين.
Especially for children, you can talk about child labor, sexual exploitation as well, unaccompanied children, children who lost all of their families and they are on the streets, non-educated children, domestic violence, etc. So yeah, those vulnerabilities have been through really hard situations. So accordingly, okay, they can be affected by this mentally, mental health wise, and they can develop, especially if I'm talking about children. Now, aggression and violence is common between them. This diagnosis of conduct disorder is too much common between children. They are developing even sometimes personality disorders. They are maybe becoming antisocial or something, but those mental illnesses come as a result of very hard situations they are being through because they are children. If we are talking about women, you name it, they have too many problems, social or culture related, starting with early marriage, domestic violence, let's say sexual exploitation. Those problems, they were already there in any community, but they became too much in war times. Since those things are happening, of course, now we have problems spread between women, mental health problems, but still they need too much support. It's not like gender-based violence, it's not a mental health issue in the first place. It's a protection issue. They need legal assistance, they need cash assistance, they need shelter, they need safe place, and they need mental health services. So it's a comprehensive approach, not only mental health.
One of the biggest concerns for healthcare providers in Syria today is the growing number of people displaced from their homes. Known as IDPs or internally displaced persons, this population includes 7 million, many of whom have left their homes multiple times due to threats to their survival. Over 54% of those internally displaced in Syria show signs of emotional disorders. In Idlib, a city in northwestern Syria, 90% of depression cases are caused by the war. They are living day to day without secure sources of income and often within camps on the fringes of the city. The uncertainty of their fate and the inability to properly mourn family members who have disappeared adds to their distress and grief. With the crisis ongoing with no end in sight, a sense of hopelessness is settling in for many Syrians.
No IDPs in Syria just moved once, in at least 5 times, at least 10 times. They're always moving. So, because wherever they move, it's relative calm sometimes in war, but again, they get bombed or shelled or whatever. So they moved again and again. Regardless the life-threatening situation, this kind of moving with their families, with their daughters, sons, and the whole family with them, it's severe stress for them. They cannot function the way they used to. They cannot, even they tried to. The circumstances, what's happening with them, it's out of their circle of affection.
A small segment in particular have faced challenges and difficulty accessing services. With more pressing priorities, it has been difficult for the Syrian community to ensure that services are equally accessible to people with intellectual disabilities.
With the beginning of the crisis, all of the institutional donors and donors in INGOs, they need to respond fastly. Most of the projects in 2012 or 11 is 6 months project, 7 months project. When we were talk about people with abilities, at least they need 2 years project. So nobody was interested to invest or to do projects for them because now we are in a response. We should cover other hundreds and thousands of people. They are suffering in health, in mental health, etc. So now after 5 or 6 years of crisis, a little bit the response still exists, but now people, donors started to be interested in early recovery, in development phase now. So now we started to talk about people with abilities, especially intellectual disabilities, to do some project. And again, as a donor, launching or establishing project for people with disabilities is not really good investment because quantitatively, you are talking about hundreds, not thousands, and they need very long care, especially if you are talking about autism or learning disabilities. They need follow-up, they need integration, they need too much efforts and very less numbers. So really, I really respect any donor. And now we, in our mental health center, which is funded by ECHO through Relief International, they are convinced with these services. And we have special, we call it SNR, or special needs rehabilitation section in each mental health center with speech therapy, with autism interventions, which is, good. But this service started people to be interested in lately. So they've been neglected for years and years. Nobody was taking care of them, but their family, and mostly they have lost maybe their family. So really they suffered a lot until now people started to be interested in them.
Mental health needs are often stigmatized, which discourages people from getting help. Mental illness remains a taboo across the world, not least in Syria, where beneficiaries worry about being labeled. These people are often shunned by their communities and spend their lives struggling with minimal support. According to the World Health Organization, more than 50% of Syria's population is in need of mental health support. The situation is compounded by a severe shortage of psychiatrists, psychologists, and social workers. Even before the war began, Syria had just 100 psychiatrists, and around half of them have since fled the country. We asked Dr. Besher what advice he would give to healthcare professionals planning on working in this field.
First of all, be professional. We have, and if don't do things, don't take this savior position. Don't try to do things is not your role to do. Don't get excited because those things are harmful. Be aware of yourself as mental health practitioners. You need to take care of yourself. to protect yourself from secondary trauma, from burnout, because there is a big lack of professionals and mental health practitioners. We have so many few of them, and we're still trying to build capacity for other people to help. So, follow the book now. Again, take care of yourself. Seek help if you feel like you are tired. Self-care is too much important in this domain, too much important. And please don't work without supervision, with professional supervision. If we couldn't, it's okay. No, it's not okay. Don't work without supervision.
The Union of Medical Care and Relief Organizations supports the well-being of Syrian refugees and displaced individuals by providing mental health and psychosocial services to over 128,000 people in Syria and Turkey.
We provide specialized services, psychiatry services, with free medication. Let's start with Turkey. In Turkey, we are operating now in 5 different cities in Turkey, in Hatay, Rihanli, in Kilis city, in Gaziantep, in Istanbul, and in Ankara. When I'm saying mental health centers, I'm talking about a psychiatrist who's working in line with psychologists. So again, to cover the comprehensive services. So people or beneficiaries can receive psychiatry services and then refer to psychologists to receive these non-pharmacological interventions or non-psychotropic, non-medical interventions, which is psychotherapy. In Syria, again, we provide non-specialized services by not psychologists, by BSWs or psychosocial workers. The other model, we have mental health, we call it mental health unit inside Syria in Idlib Sarmada. We call it unit to avoid the word hospital for the stigma reasons. And it's a mental health hospital with inpatient system of 20 beds. We provide there, it's for acute cases only. For very severe cases, they need to be hospitalized and receive psychiatric care. And of course, we have with them the psychosocial workers who are providing psychoeducation and awareness, mental health awareness sessions, or let's say campaigns, and some BSS activities as outreach. Also, we have something called mobile clinic. We have 4 mobile clinics. Each mobile clinic consists of mental health or let's say image gap doctor with 2 psychosocial workers to reach out beneficiaries who cannot reach this hospital. We can intervene them like at houses, at camps, at schools, at primary health care, other centers from other partners, and we refer the severe cases to the hospital. Of course, we also have our program in integration or integrated mental health services within the primary health care program. As you know, OSOM is in the first place, it's a medical organization, and we have hospitals and primary health care clinics or centers. So we integrated our mental health services within those centers. And we have, of course, a project called School Health Project. We are providing mental health services in 105 schools inside Syria. We are trying to spread this mental health culture between people, because since even before the crisis, there was no such culture between people. People seek mental health services again, unless they have very severe situation and they cannot control it, they cannot sleep, they cannot eat or whatever. And then they seek psychiatrists who give medication, and that's it.
In spite of the difficult circumstances, the people of Syria remain resilient. They inherently possess the capacity to rise from their difficult situations with strength and courage. They have drawn strength from overcoming their past traumatic experiences to thrive as refugees or displaced individuals.
There is something called resiliency. We should trust in people, and they are really resilient, especially Syrians. Even they have levels of resiliency. It should be studied or something. A theories can be, because I have met a lot of those people, women, children, etc. They are really way resilient than me, than myself, than even war-injured people who lost their limbs or hands or whatever. And we always do guessings in our head that, oh, he's been through this, now he should have this. No, A lot of them, they are really resilient and they can teach you or not teach you. These mechanisms they are following, it should be studied really. People can get benefits in other crises, how they could manage this kind of, let's say, events happened with them. But still, of course, for those groups of people, it's not a matter here of mental health services, or mental health situation or conditions, because mental health now comes as a result. And hopefully people be aware of this importance of mental health.
Despite the disastrous situation in Syria, there has been significant progress in the field of mental health. One of the most important achievements is the lessening of stigma around mental illness. Syrians are beginning to change their perception on mental health and recognize that everyone is under pressure and in need of psychiatric consultation. People frequently manifest mental illnesses as a result of the trauma they have experienced in their lives. These invisible wounds won't heal unless we help Syrian refugees and those displaced and prioritize their mental health. We need large humanitarian groups and UN agencies to team up with local organizations to address the mental health challenges in Syria. For more information or to support our services, please visit www.awesomecanada.org.